Children's Hospital of Wisconsin is now taking adult patients up to age 26 to free up beds in other hospitals for coronavirus patients. Welcome back to Up Front, everyone. Adrian joins us now from home. Adrian, you've been reporting from home because you yourself have recovered from coronavirus, and you had a really interesting interview with Dr. Fauci on Friday.
That's right, Matt. I mean, there's a lot at stake here with coronavirus cases soaring across the country and a major holiday coming up Thursday. I asked him what he expects to see in Wisconsin in the next few weeks. Dr. Fauci, Wisconsin is one of the hardest hit states by the coronavirus in the country right now. If we stay on this current track, what should we expect in the next few weeks?
Well, unfortunately, if we stay on this track, things are going to get considerably worse, particularly as we get into the holiday season where people will naturally want to congregate with family and friends, a natural instinct to do that. We're going to have to take a look and do a risk-benefit determination. Each family unit needs to do that about getting people in closed places indoors with, when you have the typical traditional beloved Thanksgiving meals and Christmas meals. We're going to have to take a look at in our own families when you have people who might be of a high risk of a serious outcome of either elderly or with underlying conditions. Is it wise and prudent to have the kind of traditional celebrations that we do? One good thing that's on the horizons is that help is on the way with vaccines, because we have two vaccines that are extraordinarily efficacious in preventing significant disease and certainly serious disease. They're going to start being implemented probably by the end of December. And so the message is hang in there because help is really on the way.
And I do want to ask you about the vaccine because Pfizer just submitted that application to the FDA for emergency use authorization. So realistically, when could Wisconsinites have a vaccine?
Well, you've got to be careful because you can't look at Wisconsinites as a unidimensional group. In Wisconsin, you have healthcare workers. You have people who are frontline essential workers. You have people with underlying conditions. You have elderly people. And then you have people who are young and don't have anything that's an underlying condition. So you can't group Wisconsin as a unidimensional group. If they decide in their prioritization that healthcare workers who are on the front line taking care of patients are going to be the priority, you could have people in Wisconsin getting doses in December. And then as we get into January, more. It's not going to be one state versus another state. It's who within the state is in that priority group.
And then in terms of someone who is healthy, but just concerned, when do you think they could get a vaccine?
The projection is, and it's not going to be exact, but I think the projection will be close to being accurate, is that as we get towards the end of the first quarter of 2021, sometime in April, and then as we get into May, June, it'll be more and more people. Hopefully, by the time we get into the middle or end of the second quarter of 2021, we will have vaccinated everybody who wants or needs to be vaccinated.
How soon after the vaccine do you think we'll start to get any sense of normalcy again?
Well, that depends on the percentage of people in the population who take the vaccine. So I would hope that virtually all the population gets vaccinated. If we do that, we'd be able to crush this outbreak for sure. But we want to make sure people do take the vaccine and get over that skepticism about the vaccine.
And Dr. Fauci, when you go to bed at night, what are you most concerned about? What do you lose sleep over with this coronavirus?
Well, before we had the SARS coronavirus 2, the thing that kept me awake at night was the nightmare of actually this happening. So I'm already living the nightmare. So right now, within the context of the nightmare, my concern is that as these cases continue to soar, people don't take it seriously and don't mitigate with the public health measures that I'm talking about. And people don't take seriously the importance of getting the vaccine when it's available. That worries me the most. This is not fake news. This is not a conspiracy. This is a real serious disease.
And you can see my entire interview with Dr. Fauci on WISN.com. Just click the upfront section. And you know, Matt, I know you reported on that warning from the Wisconsin Hospital Association. So I talked to the chief medical officer for Aurora. Right now, they're delaying half of their elective surgeries. He describes his staff as battle weary and says what happens next depends on all of us.
In healthcare, we're at the tail end. By the time we're interacting with somebody, they're typically already infected or there's a concern about infection. Addressing this really starts on the front end, and that means prevention from the outset. It means taking good care of yourself and understanding that no matter how well-intended your visit to a friend or neighbor might be, no matter how annoying it might be to put on a mask to go into the grocery store, those things actually end up saving lives. We have the power to control this. And the question is, are we disciplined enough? And from the numbers that we're seeing, we're encouraging even greater discipline right now.
So, Matt, as you heard there, a lot of concern from medical experts in terms of what will happen in the next few weeks here.
So much to talk about. Adrian, it is so good to see you. We will see you back here in studio next week.
I'm looking forward to it.
We are too. Adrian, thank you. Coming up, a recount in 2 Wisconsin counties and the Trump lawyer who says the president can still win here.